Hey, Dr. Jerry Williams, Urgent Care 24/7, here to talk to you for a minute about throat cultures. Why does your medical provider recommend them? Well, actually, it's really important. There's lots of crazy things that grows in the throats of humans, for that matter, in the throats of all animals. But let's keep it to humans today, because I'm a medical doctor. I'm a people doctor. I don't know anything about animals. But what I do know about pharyngitis in people is that it actually can be a very serious illness. Now, it's incredibly common illness, so a lot of people think, well, I've got a sore throat, it's probably strep throat, and we'll just see if it gets better. Well, that's kind of a dangerous thing to do, because if it is strep throat, there's all kinds of systemic, body-wide problems that can arise after an untreated strep throat. You ever heard of rheumatic fever? Or maybe, here's a fancy one, there's post-streptococcal glomerulonephritis. There's all kinds of different illnesses that can come from an untreated strep throat infection. So it's really important that if you have a sore throat, you go get seen by your medical provider. And one of the first things they're probably going to do is they're going to do a rapid strep test. And if it comes back positive, you've got your answer, because false positives with rapid strep tests are pretty uncommon. But what if your rapid strep test is negative? Then what do you do? Well, in this case, that your medical provider is going to recommend that they do a throat culture, which is they take a swab and they swab down your throat and they send it off to the lab to see what they can grow the bacteria that's growing in your throat that's causing your sore throat. So they'll send that off. Well, there's also other causes that are non-bacterial, like viral infections that can grow in the throat, where you won't pick that up on a bacterial throat culture. So, in fact, viral pharyngitis is incredibly common. But the streptococcal pharyngitis infections that are very common, quote unquote, strep throat, are really important that we diagnose them properly. And then we give appropriate antibiotics for the group A streptococcus bacteria that causes most strep throat, or causes most throat infections. And group A streptococcus is the most common bacterial throat infection. So really important that you allow your medical provider to swab your throat a second time or once with two swabs to make sure that one is for the rapid strep, and if it's negative, then they send the other one off for culture to see if it grows out streptococcus. That way they can treat you with appropriate antibiotics and prevent any post-streptococcal complications that could affect your heart, your kidneys, and other parts of your body. Hey, Dr. Jerry Williams here from Urgent Care 24/7. Thanks for watching the video. I hope you found it to be useful. If you could do me a favor, if you like the video, be sure to click on the like button. Also hit subscribe. And when you hit subscribe, click on the notifications and click the bell there. That way you'll be sure to be notified every time Urgent Care 24/7 and Affiliates releases a new video. And remember, life is 24/7, and so are we.